Welcome back to HealthWise. With us is Dr. Carl Gonsoulin, and we were talking about dental health and how it affects or can affect school performance. Doc, what are some of the reasons why if you have bad dental health or whatever, what does that do to school performance and learning?
Well, there's several things. If a child is in pain, his attention is not going to be able to be on his studying because he's hurting, okay? And if his mouth is not healthy, that also is not a good deal. You want him to be able to be there, be healthy, have his attention on his studies so he can get the most he can out of school. So keeping these teeth in good shape can prevent these problems from the teeth from interfering with it. And so that's why it's important to get these teeth taken care of if there are problems. The most important thing is prevent it from happening, but prevent as much as you can, get the things you aren't able to prevent handled quickly, and if they have problems during the school year, they have to get these problems taken care of so they miss school, so you don't want to have to miss school. It is very important for the children to keep up their dental checkups during the school time, because school takes up such a large portion of the year. You can't do it all just in the summertime. Right. But generally you can arrange where they can have a summer checkup and a winter, in-school checkup. And if you're doing that, you can keep things under control, and you can prevent as much of the problems as possible. And of course, if a child has really unsightly teeth or something like that, it can be the subject of teasing by the other kids. Sometimes the kids can be really rough on them. And so that, of course, it makes it difficult for them to want to do well and be at school for that reason. So we don't want that going on, okay? No, not at all. And there's a certain amount of control that has to be done for the other kids, that's because it's not okay for that to happen, but it happens. And so we don't want that going on. And so, like I said, if you can prevent the problems, it's very simple. A short checkup once during the school year is not a big deal. Right.
And what about during the summer?
And in the summertime, same thing. If you prevent the problems. Now, the summertime is our busy time for kids because they're out of school. Anytime the kids are out of school for any kind of holiday, stuff like that, we're very busy because the parents want to get them in at that time, and we do everything we can to help them with that. The big thing about the summer is that all of a sudden school's here, okay, and summer's over with, and now we have a big rush to get the kids into school, and so we'll get these kids checked and everything, but if they need to have work to be done, a lot of times we don't have time to get the work done before the school starts. So we definitely recommend that the parents bring their kids for their checkups well before school starts. So if there's something that needs to be done, we can get them in before school starts and doesn't interfere any more than necessary with the school year.
Okay. Well, one of the questions I want to ask you, and one of the viewers had asked me this one time and wanted me to ask you, what about bad breath as far as what they call it, halitosis? Does the teeth cleaning, what effect does cleaning the teeth or not cleaning the teeth have on that?
Well, there are several reasons for bad breath. Of course, if your teeth are dirty, lots of plaque on the teeth, okay, all right, or cavities and holes, and you got all kinds of food stuck between the teeth. Of course, you can have bad breath because of that, okay. Now, the younger child, the tongue is not as rough. It doesn't trap the bacteria as much as a more mature tongue would do. All right. So generally, if you have bad breath for a young child, it's generally not so much tooth-related unless there's a lot of cavities or something going on. Okay. Usually it's more of a sinus problem or a stomach problem. You're getting the odor from that. Okay. And especially when you got a flu season going on, cold season going on, you might have a breath problem that would come. And if it comes and goes with the illnesses, then it's probably related to that. Of course, keeping the teeth clean will help. Okay. If it's tooth-related or mouth-related, keeping the mouth and the teeth clean, brushing the teeth, flossing the teeth, cleaning the tongue will help. The older the child gets, the more teeth they have, the less control you have over the diet because they're not at home as much or whatever. And the more that the child is taking care of his teeth, the less control you have over what needs to be done until they get to a mature enough age where they're going to want to do a good job and do a good job. Then the teeth can be more of a factor as the bad breath is concerned. But clean teeth, clean gums, a clean tongue, and rinsing or drinking water frequently washes the mouth out, especially when you're at school. It's always a good idea to brush your teeth after eating. brush your teeth before you go to school in the morning. Bring one of these little travel toothbrushes. Brush your teeth after eating at school. If you don't have a toothbrush, you can just rinse your mouth out. Swishing and swallowing after eating something at school gets the food out of the mouth, kind of rinses the mouth out. It cuts down the bacteria count, and that will help. And then at home, do a good job of brushing and flossing before going to bed.
What now? You mentioned about the tongue. You know, you see these little, what do you call them? I think they call them tongue brushes. They make these things that you can go get. Are those effective? You know what I mean?
Well, yeah. On an adult tongue, the little papilla, the little tongue is much rougher.
Right.
Okay, and it can trap a lot of debris in there. It can trap a lot of bacteria in there, and it'd be amazing what you can scrape out of that tongue. Okay, and you have these little scrapers, these little brushes, and it's a good idea to do that. You want to use it, get good instructions how to do it, so you don't injure the tongue or braid it or anything like that. But you can brush your teeth and still leave the tongue quite dirty, and then the tongue can be a source of more bacteria plus an odor. So using a tongue scraper or something to clean the tongue is a very good thing to use. Okay, it's more when they get to the teens and the older ages rather than the young kids. When you're brushing a young child, you wouldn't have to worry about that as much.
Okay, what about gums? That's something I wanted to talk about too. Gum health. I mean, especially as kids. I mean, I've heard all kinds of things. We've heard a hard toothbrush. You know, the harder the toothbrush, the better. I remember there was an old, I guess it was a wives' tale, and I know it now. It was a wives' tale. They used to say, "Man, if you got to make those gums bleed, because that's the only way if they bleed, they're gonna be pink and healthy."
Well, that's not quite works that way. We recommend like a fairly soft toothbrush, decent, and they have lots of good toothbrushes out there. They have lots of good electric toothbrushes and manual toothbrushes. A manual toothbrush works just as well as the electric toothbrushes in most cases, all right? You just got to use a little bit of elbow grease on it, that's all. And you want to, the same thing that causes the cavities causes the gum problems, and that's the germs on the teeth. The germs lodge between the teeth, in between the gums and the teeth. And when you're brushing the teeth, you want to make sure you're cleaning the gum line well with the brush. And if you're just brushing and not flossing, you're going to leave about 40% of the tooth unclean, where most of the cavities occur, or a lot of the cavities occur, and most of the gum disease gets started. So, you know, I like to use it's like taking a bath and never cleaning in between your toes. Well, after about 20 years, you might have your toes start falling off or something like that. And so if someone is only brushing their teeth, and you take a teenager, his first tooth comes in around age 6, he's 16 years old, that tooth has been in the mouth for 10 years. And
if he's never flossed, he's got 10 years of grind.
And flossing twice a year at the dental office is not going to cut it. You know, it's a daily thing. One good flossing a day generally is good enough, and 1 or 2 brushings a day will generally take care of it. You know, and so if you keep those gums healthy, there's no reason to lose your teeth, because if you're not getting cavities, you're not getting gum disease, or the few cavities you get them taken care of quickly,
you won't have a problem.
And you have a few unusual cases where you have some teeth that are really out of line or some damage to the teeth, and those things can be handled fairly easily. Okay.
Well, we're going to take one more brief break for our sponsors, and we'll come back and we'll talk a little bit about some of those other things that might happen to the teeth.